Hey, so we are back to Ableists today. If you are a person with disability, you must have encountered certain ableist attitudes among doctors. Ableist attitudes among doctors, though not representative of all the doctors, can unfortunately exist within the healthcare system. And this is my personal experience. These attitudes can manifest in various forms, in various ways, and they can include pity or patronizing behavior on their part. Doctors may display a paternalistic attitude towards individuals with disabilities, viewing them as objects of pity or assuming they are incapable of making decisions for themselves. This can undermine the autonomy and agency of patients. They can also be stereotyping and generalizations on their part. Doctors may hold preconceived notions and stereotypes about individuals with disabilities, assuming they have limited abilities, intelligence, or potential. Such assumptions can lead to inadequate or inappropriate medical care and again undermine the patient's individuality. For instance, assuming that a person with a physical disability is incapable of independent living, or assuming that individuals with intellectual disabilities lack decision making capacity. So, when I complain my doctor of my post polio syndrome and the symptoms that I get, and I can't do more of the exercises, the doctor instantly told me that I was getting lazy. And then there can be diagnostic overshadowing. This occurs when a doctor attributes a patient's symptoms solely to their disability without thoroughly considering other potential causes. This can result in overlooking important health concerns or dismissing symptoms as solely related to disability, potentially leading to a delayed or inadequate medical treatment. And all this can result in overlooking or dismissing legitimate health issues that may require medical attention, and ultimately it can lead to comorbidities. Lack of communication and empathy can be there. Doctors may fail to communicate effectively or show empathy towards individuals with disabilities. This can result in patients feeling unheard or dismissed or devalued, leading to a breakdown in trust and reluctance to seek necessary medical care. Healthcare professionals may overlook the communication needs of patients with disabilities, particularly those with hearing or speech impairments, because we know there are no sign language interpreters in the clinics or even in the multi speciality hospitals. Consequently, limited or ineffective communication leading to misunderstandings or inadequate healthcare information exchange can be there. Certain times, the attitudes can be dismissive or condescending. Some of the healthcare professionals may exhibit dismissive or condescending attitudes towards individuals with disabilities, inadvertently undermining their expertise, experiences, or self determination. And all this can lead to a patient's feeling unheard, disrespected, or excluded from their own healthcare decisions. And this makes them all the more dependent, especially women with disabilities when they cannot communicate about their sexual health concerns to the doctors. Inaccessible and physical environments can be there. Doctors may overlook the importance of creating physically accessible healthcare environments, such as accessible examination rooms, equipments, or communication aids, which can create barriers to effective care for individuals with disabilities. And then dismissal of accommodations and support can be there. Doctors may resist to dismiss the need for accommodations or support services requested by individuals with disabilities, potentially limiting their access to equitable healthcare. Healthcare professionals may disregard or downplay accommodation requests made by individuals with disabilities. They think that the person is throwing tantrums, and this can hinder their ability to fully participate in healthcare encounters or receive appropriate care. It is crucial to take accommodation requests seriously and provide reasonable accommodations as needed. Then we can see lack of disability related knowledge and training. Healthcare professionals may have limited knowledge about disability issues, including specific impairments, accessibility requirements, or disability rights. This knowledge gap can lead to inadequate or inappropriate care, reinforcing the ableist norms. Patients may feel ignored or dismissed by healthcare professionals. This is a common experience for many people with disabilities who may be seen as less credible or less deserving of care than people without disabilities. For instance, a person with physical disability may be told that their pain is not real or that they are exaggerating their symptoms. This is very unfortunate. Patients can feel as being treated as a child or a burden. This can be frustrating for persons with disabilities who are adults. A person with developmental disability may be asked to bring a caregiver with them to every doctor's appointment, even if they are perfectly capable of making their own decisions. And for a variety of reasons, such as lack of accessible facilities or lack of understanding, they can be denied care. A person with visual impairment may be denied surgery because the hospital does not have a braille interpreter or the hospital cannot provide access to the patient. Then the language can be discriminatory or the behavior can be discriminatory. And this can include making assumptions about persons' abilities, using derogatory terms for making jokes about their disability. For instance, a person with mental illness may be told that they are crazy or they need to get over it. So addressing these ableist tendencies, it requires ongoing education, awareness, and reflection within the healthcare profession. And by promoting inclusive practices, patient-centered care, accessibility, healthcare professionals can work towards dismantling ableism and creating a more equitable and inclusive healthcare system for all individuals, regardless of disabilities. So in my next video, we would learn about how healthcare professionals can shed away their ableism, how they can improve upon themselves